So this is the West Yorkshire Police partnership approach to drugs and alcohol misuse. Again, connected to the police and crime plan, and we know is often a causal link around crime and antisocial behaviour. There are clearly much wider issues around government policy, I would suggest, on alcohol and drugs. Previously, I have commissioned a review of the drugs intervention programme in West Yorkshire, but it's a few years ago now. I've also raised the profile around drugs and alcohol misuse through community safety forums, and continue to provide funding to various projects. So again, the Safe Communities Fund has been used to support 45 projects, totalling more than £184,000 across West Yorkshire, and obviously partners in the public health arena are really important in terms of commissioning of services and better understanding some of the issues. So I'll pass on to update on this.
Okay. I think it's fair to say, as you've mentioned, that the symptoms of drugs and alcohol addiction are varied, but unfortunately that does quite often bring those people into contact with the police. And treating the causes of some of that is very much, I think, a partnership issue, a health issue, a public health issue. But nevertheless, it's really important that as West Yorkshire Police employees and people who do come into contact with people with addictions, specifically, I guess, offenders, but actually also vulnerable people and victims as well, who we can help to signpost to different agencies within communities, not necessarily punitive sanctions. It's important that our staff understand where they can signpost people to and what is available for people with addictions very often, because in terms of the offenders, it is because of those addictions that the crime is being committed in the first place. So if we can treat some of that, then, essentially longer term, we should have less crime in theory. 27% of our detainees over the last couple of years, actually it stayed really steady, tell us that they are alcohol or drug dependent when they come into custody. I think it's important to say not all of those people will be addicted, but nevertheless, it is such a significant part of their lives that they feel it's something that they're happy to disclose and mention when they come into police custody. And mental health issues are often really closely linked with alcohol and drug addiction and dependency. So that is sometimes quite a difficult cocktail of things that people who are working in that custody environment need to manage, not just in terms of, on the one hand, wanting to progress an investigation to get a good outcome for a victim, but also managing the risk of that particular individual whilst they're in custody, and that's sometimes a really difficult balance, I think, to strike. You mentioned the drugs intervention programme, which is something we use at point of arrest, either when somebody has been arrested for a drugs offence or a trigger offence. So that might be a burglary, for example. So if somebody's brought in on suspicion of burglary, they say that they're drug and alcohol dependent, and the inspector thinks that it is as a result of that addiction that offending is happening. That's what's known as a trigger offence, and we will also do a test in those circumstances. And if somebody shows positive, then there is an assessment that's done in custody, and it will also be taken into account in different reports as we move with that offender through the criminal justice system. Ultimately, you would hope that whatever the outcome is, that the result of that then should be that at least the offer is there of some treatment for that person, albeit we can't always mandate that is taken up on. Liaison and diversion in custody, you will know about. It's already happening at Leeds and Wakefield, and is about to be rolled out across different places, the rest of West Yorkshire. with a real focus on improving health outcomes for people in the criminal justice system. And there are very bespoke interventions there for women, both at that point of referral to women's centres across West Yorkshire, but also then when people get sentenced and they're in women's prisons, there are particular programmes that people can be signposted on, trying to think about the differences and the reasons why females might be addicted to drugs and alcohol versus why men might be, and there might be very different tactics that we need to employ in terms of that. We've already mentioned antisocial behaviour earlier on in the afternoon, but I think it's important to also say that, you know, out in our communities, drugs and alcohol addiction do have an impact on antisocial behaviour. And again, the neighbourhood teams are a really important link there with partners and communities. There are things within the antisocial behaviour legislation, such as public protection space orders, public space protection orders, I should say, sorry, I got that the wrong way around, where we can really work with communities and local authorities on issues that really affect quality of life issues. So I think it's fairly obvious that in city centres, you know, there will be really good evidence of, and I know there's one in Leeds where we can put restrictions on certain streets in terms of people drinking alcohol, and that linked to antisocial behaviour. But there's definitely more moving forward, especially in terms of antisocial behaviour around drug use, especially in, you know, in some place. I'm just trying to think of specific instances where perhaps older or vulnerable people who might live in sheltered accommodation or flats, actually that those kind of stairwells and things are used for that antisocial behaviour and drug dealing, which make people feel really unsafe. So we can utilise those public space protection orders to try and make those places more safer for people that should be there and more difficult for people that shouldn't. So I think moving forward we can really make links between the drugs, the alcohol, the antisocial behaviour, and try and be more proactive in the way that we engage with that moving forward. So I think that's kind of highlights that I pulled out of the
I suppose from where I'm coming from, Commissioner, is we have been talking about drink and drug addiction for as long as I've been a police officer. And whilst the stable position is helpful, it just reminds me that actually there are still huge issues that we still haven't resolved. And I don't think that the police trying to enforce our way through this problem is the answer, because we've been trying to do that for years. Actually, if we can change the mindset, particularly of our neighbourhood officers and PCSOs, to think of individuals as being vulnerable people, many of whom have got an addiction, who are actually at risk of being exploited in one way or another, our mindset starts to change from thinking of them as offenders to thinking of them as victims themselves, which in many cases they are. Some of the crime they commit is to support that addiction, but some of the crime they commit is because they are being exploited by other individuals who realise that they are vulnerable. And I just think that we need to have quite a different conversation moving forwards about how to best tackle some of these issues, not just locally here in West Yorkshire, but actually nationally, because we keep on having the same conversation. And interventions and enabling people to recover from some of those addictions is absolutely fantastic, but we still keep on having the same conversations. So a lot of the work that we are doing, it feels as if we are doing our best to try and deal with things on a day-to-day basis, rather than a much longer-term strategy about dealing with some of these issues.
Yeah, no, thanks for that. And yeah, so some of these are much bigger issues, obviously, than one police force here in West Yorkshire being able to deal with this. And in my view, it is long overdue, actually, that government should be looking at this cross-party around the whole drugs and alcohol policy sort of arena anyway. And you know, clearly I know in Durham, for example, that a particular view has been taken there, but to be honest with you, you know, the size of Durham as an entity is a completely different ball game to an area the size of West Yorkshire, but nevertheless some of the approaches been taken that are worthy of further sort of consideration on a wider front. I mean, I mean, the question I'm probably going to pose initially is probably, you know, very difficult to answer anyway, but it's really just to do you have a sort of a feel for the number and sort of complexities, if you like, of dealing with those who have significant drug and alcohol issues in our communities, or is it something that is probably too hard to quantify?
I think in our communities it's really difficult to quantify. I think we can say people that come into custody we've got a good idea about. And I actually think that the neighbourhood staff and the fact that we record when alcohol and drugs are involved in incidents, so there are certain flags, I think we can have a good idea. But there'll be you know, many other people that we don't come into contact with that also have that, you know, some of the same issues with addictions that we've talked about, and they'll make people vulnerable in one way or another. Sometimes we will come into contact with them, sometimes we won't. I think it's a really difficult thing, and probably is a question that perhaps health and public health would be more in a position to answer than we would.
It feels like a fantastic subject for a piece of university research because there are so many different agencies that touch upon this particular issue, from those who are involved in providing charitable support on a voluntary basis, to the medical profession, to areas where perhaps offending has an element of alcohol or drug abuse attached to it, but actually at that particular moment in time that's not the obvious factor. To talking to people at schools and the AA, for example, I think there's a number of different agencies who would give you a different perspective, but actually probably a really, really good indicator would be the retailer agencies that are actually involved in how much alcohol they sell, to give you a scale of just how much, you know, if you were to do that kind of average of what's supposed to be good for our health or not so good for our health versus how much is actually sold within a particular area, I think we will probably be quite alarmed, and that will probably give you a bit of a scale of just how much alcohol dependency there may already be out there, bearing in mind that that's just what is sold through the appropriate retail outlets, because of course some of it is brought in from elsewhere. So I just think that the sheer size and scale that you're asking about, Commissioner, really difficult. The only snapshot that we get is, in truth, as Catherine has said, those people who actually come into custody, not necessarily those people we come into contact with.
Yeah. And I mean, paragraph 17, it mentions conditional cautioning. Do you think that those are being used proportionately for the right detainees as an alternative to charging in certain circumstances?
I do, and I think that it's a well-embedded process now across West Yorkshire. We've talked about it at local accountability meetings. People have a really clear understanding of when they can and can't be used. There are procedures in place to make sure that they are given proportionately and to the right people. So there's certain checks that are done around eligibility, and supervisors have to agree to that before a conditional caution is given. We also have a scrutiny panel which is held on a quarterly basis, which obviously your office is involved in, and a number of other agencies, including the CPS and the courts, are also included in that. And at that panel, they review conditional cautions and look at the appropriateness and also any lessons to be learned. I think we are in a really good position. I think there are certain other things, as we've mentioned throughout this afternoon, that we could add to in terms of conditional cautions. But, in terms of are they being administered correctly, proportionately, and to the right people, I think we can have some confidence that they are.
Okay, well, thanks for that. I guess the follow-up to that then, or follow-on, should I say, is are we aware of then offenders who don't choose to access that support, whatever it may be in a particular district, and what are we doing with partners to sort of address that, if that is indeed happening?
Yeah, so I think there's a number of different levels, and depending on what level people are at, depends on what we can do about it if they don't comply. So if they're subject to a statutory requirement to attend and remain for a drugs assessment and they fail to do so, then they're liable to arrest. So we've got quite a lot of control around people who fall into that category. If they're subject to the conditional caution, and part of that is a requirement for them to attend a support service on one or more occasions and they don't, then again they're liable to be charged, and they know that with the original offence because that's part of the condition of the caution. So again, we've got quite a lot of control around that. We've also got quite a lot of control around some of our repeat offenders who are subject to IOM management, because the links in, whilst we might not have specific legislative control, we have that ongoing relationship whereby we are trying to help them turn their lives around and direct them towards support services. I guess where it's more difficult is where we have no further action taken against somebody because either we haven't got the evidence or because actually they've proven that they haven't committed whatever crime we've arrested them for. And whilst we can try and signpost and encourage them to go to the right places, we don't have any control if they don't. So that's where that linking with neighbourhoods and partnership resources is really important, to try and get not a police resource necessarily, but the most appropriate resource into that individual or family to start trying to work with them to make improvements for them moving forward.
Yeah, I guess some of my concern around this is, obviously I'm aware of the integrated offender management approach that's been in place for some time, drug intervention programmes, the review that took place a few years ago. I just worry about the levels of provision that are actually now being provided.
I think that's the key issue.
Yeah.
And there's good evidence, isn't there, that says if you haven't accessed a treatment option within 6 weeks, you won't.
Yeah.
And so it's making sure that the provision is there for people to be able to access almost as soon as they are released from custody is the best chance and best opportunity to try and divert that individual from further either offending or indeed to try and tackle that addiction.
Yeah. So I think it's timely again for us to look at the different levels of provision, because certainly in certain parts of West Yorkshire, from what I've been told, it still sounds quite good and robust. In other areas it doesn't, and obviously it shouldn't rely on the postcode, should it?
And that's where engaging with health service providers is absolutely business critical, because it's in their best interest to also invest in that early intervention approach.
Yeah.
And it'd be interesting to see, if we could, that compare and contrast between hospital admissions in those areas that have got good provision versus perhaps those areas that don't.
Yeah.
There might be some interesting, evidence to be able to encourage people to then invest in those.
Yeah, and understanding that our liaison and diversion programme as well is a key sort of factor from that. And then finally, the legal highs, or now illegal highs, as they're now termed, spice being one of those. We hear about the availability of it still in prisons and secure children's homes, for example. Is there any work being done to sort of tackle that aspect? Because of the sort of impact it has, and we hear about.
Yeah, absolutely. Yeah. So we've recently appointed a force drugs coordinator who is in the process of visiting the prisons and secure establishments for children. We've only got one in West Yorkshire. But before that, for example, Leeds Prison, as a result of the partnership approach, have new processes that have been introduced within the prisons to minimise the amount of spice that's entering. Working alongside us, we've then done some kind of high visibility patrols at particular times to prevent around the boundary of the prison those drugs being sent into the prison. And there are a number of other tactics that are also being applied, which is probably not appropriate to go into at this meeting. I think suffice to say that there's collaboration between ourselves and Leeds Prison, Wakefield Prison, Newhall Prison in relation to introducing the processes to try and prevent things going in, but also to make their staff aware that actually if there is drugs misuse within prison, we need to know about it. And that's not always been the case, I don't think, and that process has been strengthened. We have got IOM teams based in all 4 of the prisons as well, who are able to support detainees who are found with spice and other drugs within prison to make sure that they are given as much help whilst they're in prison or secure accommodation as possible to give them the best chance of not reoffending when they come out. And in relation to the secure children's homes, like I say, there's one in the county and there's not been any reports in relation to use of spice at that location, not in the same ways that we find at the prisons. But there is a meeting that's been organised which Stuart Piper is going to in relation to that home at the beginning of June, where we will address that along with a number of other issues. So I think the Force Drugs Coordinator moving forward will continue with the plans that are already in place, and hopefully will, once they've had a real good chance to have a look at what processes are in place, we'll be able to suggest some further improvements that we can make moving forward.
Okay, thanks so much for that, and I'm sure we can feed that through the local criminal justice board meetings as well. Right, well, thank you very much for that final update.